Are you feeling a heaviness or pressure deep in your pelvic area that just does not feel normal? Do you ever notice a small bulge when you're showering or wiping something that was never there before? Maybe your urine suddenly sprays sideways, or you find yourself straining to have a bowel movement even when you are eating well. Some women tell me they feel as if something is slipping, dropping, or even falling out of their vagina. And the hardest part is this: most of them are too embarrassed to tell anyone. If this is happening to you, please stay right here with me. What you are experiencing is far more common than you think, and you are not alone, you are not broken, and you do not have to live the rest of your life around discomfort, bathrooms, pressure, or fear. Let me tell you why I take this so seriously. Many women over 60 spend months or even years hiding these symptoms. They cancel lunch plans, they stay home instead of walking with friends, they stop traveling because they don't know what their body will do that day. They avoid intimacy because they feel embarrassed or frightened something may worsen, and yet almost none of them know the truth. Pelvic organ prolapse is common, treatable, and absolutely nothing to be ashamed of. I am Dr. Tercez. Lily Stones, a board-certified gynecologist with more than 30 years of experience helping women across the United States navigate menopause, aging, pelvic support issues, and intimacy changes. I have seen women at every stage of life experience symptoms like pressure, bulging, discomfort, or difficulty emptying their bladder or bowels. I have treated women as young as 23 and women in their 80s. The average age for noticeable prolapse, however, is about 70. So, if you are over 60 and something feels off, you are in the right place. Before we go deeper, I want you to hear this clearly. Pelvic organ prolapse is not your fault. Pregnancy can stretch tissues, vaginal childbirth can weaken support structures. Menopause reduces estrogen, which means collagen decreases, and tissues lose elasticity. Chronic constipation forces the pelvic floor to strain for years. Obesity increases downward pressure. Even heavy lifting over time can contribute. These are life experiences, not failures. And the more we talk about them openly, the sooner women get the comfort and confidence they deserve. Here is the part most women never hear until they walk into my office. Prolapse can involve several different organs, and each one causes different symptoms. When the bladder drops, urine flow can change. When the rectum bulges forward, bowel movements become difficult. When the uterus descends, pressure and heaviness increase. If you have had a hysterectomy, the top of the vagina itself can loosen and drop. And the most important thing to understand is this: the earlier you recognize the signs, the easier it is to manage or correct them. You might be surprised to learn that in the United States, women have about a 13% lifetime risk of needing surgery for prolapse. But far more women can be helped with non-surgical options if they seek help early. Yet embarrassment keeps so many silent. They whisper their symptoms. They wait until the bulge is large or painful. Some wait until they cannot sit comfortably. And by then the problem is more advanced than it needs to be. That is why I am here with you now to give you clarity, reassurance, and real solutions. In this video, we are going to walk through what prolapse actually is, why it happens, how to recognize the early signs, and what your true options are. We are going to talk about lifestyle changes that protect and support your pelvic floor, non-surgical devices that can make you feel comfortable again, and the surgeries that are available today that are safer, less invasive, and far more effective than what existed 20 years ago. You deserve to understand your body. You deserve comfort and confidence. And you deserve to live your life without worrying every time you stand up, walk across the room, or sit down to use the bathroom. So stay with me. By the end of this video, you will know exactly what steps you can take, how to talk to your doctor, and which modern treatments are truly worth your attention. This is your chance to take back control of your pelvic health. And I am here to guide you every step of the way. Now that we have opened the conversation, let's talk clearly about what pelvic organ prolapse actually feels like and why so many women misunderstand it. One of the biggest challenges is that prolapse does not show up the same way in every woman. Some women feel a dull heaviness that becomes worse as the day goes on. Others notice a pulling sensation when they stand for long periods. Many women see or feel a soft bulge at the vaginal opening, especially during a shower or when wiping after using the bathroom. And then there are women who do not see anything at all, but something simply does not feel right in their lower pelvis. One common misunderstanding is believing that this is just a normal part of aging. I hear this often. Women tell me their mother had it, their grandmother had it, or they were told it was something they simply had to accept. But just because something is common does not mean it is normal or that you should live with discomfort. The truth is, pelvic organs are meant to be supported. When that support weakens, your body is sending you a message that deserves attention, not silence. Let me explain what actually happens inside the pelvis. Your pelvic organs are held in place by connective tissues, muscles, and ligaments. Over time, these structures can stretch, weaken, or tear. When that happens, one or more organs begin to shift downward. If the bladder drops, we call it a sister seal. If the rectal wall pushes forward, it becomes a rectoil. If the uterus descends, that is uterine prolapse. And for women who have had a hysterectomy, the top of the vagina itself can begin to fall, known as vaginal vault prolapse. Each type brings its own challenges. A prolapsing bladder can cause urine to spray in unusual directions or make it harder to start your stream. You may feel like you need to empty again even after just going. Erectile can make bowel movements more difficult, leading to straining or the feeling that stool gets stuck. A uterine prolapse often creates a dragging sensation, like something is pulling downward from inside. And when the tissues weaken enough for a bulge to appear at the vaginal opening, sitting can feel uncomfortable or awkward. Another problem I see often is that women underestimate how much constipation contributes to prolapse. Years of straining places, enormous pressure on the pelvic floor, pushing downward every time you try to have a bowel movement. This is one of the most preventable causes, yet the most overlooked. Keeping the bowels soft and moving gently is one of the first steps to protecting your pelvic support, especially after 60. Let's talk about childbirth. Vaginal deliveries are a major risk factor, particularly if you had a large baby, a prolonged labor, or significant tearing. But even women who delivered by C-section can develop prolapse because pregnancy itself stretches the support tissues. Menopause is another major factor. Once estrogen levels drop, the tissues become thinner, less elastic, and slower to recover. This is why so many women first notice symptoms in their 50s, 60s, or 70s. Obesity also plays a role. Extra weight increases downward pressure on the pelvic floor throughout the day, especially when standing or lifting. And speaking of lifting, years of carrying heavy laundry baskets, grandchildren, or groceries can subtly strain these muscles. It is not always one big event. Sometimes it is decades of small stresses that finally weaken the system. One more thing many women do not realize is that prolapse can worsen slowly. At first it may feel like a little pressure, then a mild bulge, then a bigger bulge during activities. Some women tell me they can push it back in temporarily. Others say it disappears when lying down, but returns when standing. These are important early signs, and the earlier you address them, the more options you have to improve or even reverse your symptoms. In this stage of the video, my goal is simple. I want you to recognize the subtle signals your body may have been whispering for years. Pressure, heaviness, difficulty emptying your bladder, constipation, urine, spraying discomfort during intimacy, or a visible bulge. None of these should be ignored. These are not just inconveniences. They affect your quality of life, your confidence, your mobility, and your social connections. And the longer they persist, the harder your tissues must work to hold everything together. Now that you understand the problem more clearly, let's move forward. In the next part, I will walk you through the real practical solutions that women in the US use every day to manage or correct prolapse, from simple lifestyle habits to medical treatments that are safe and effective. Now that you understand why prolapse happens and how it shows up, let's talk about something far more encouraging. There are real practical solutions that can help you feel better, support your pelvic organs, and restore your day-to-day comfort. And the good news is this: not every woman needs surgery. In fact, many women begin to feel relief with simple changes that strengthen the pelvic floor, reduce pressure, and protect the tissues that are still supporting everything inside. Let's begin with something many women overlook: vaginal estrogen. After menopause, estrogen levels drop dramatically, which makes the tissues thin, dry, and less elastic. This is one of the biggest reasons prolapse tends to worsen after 60. Vaginal estrogen is not the same as full-body hormone therapy. It works locally, right where you need it, and has been shown to strengthen the vaginal walls, improve elasticity, and support the tissues that hold the bladder and uterus in place. Many of my patients tell me that within a few weeks they notice better comfort, less dryness, and improved pelvic support. And for many women, especially those with mild to moderate prolapse, this alone can make daily life much easier. Another important tool is pelvic floor therapy. When taught correctly, pelvic floor exercises do much more than tightening the muscles. A trained pelvic floor therapist can show you how to coordinate the muscles and breathing patterns that support your bladder, uterus, and rectum. This is especially helpful for women who have been unknowingly contracting the wrong muscles for years. Pelvic floor therapy cannot fix torn tissues, but it can significantly improve support and prevent further progression. Many women begin with simple exercises lying down, then progress to movements that help them stay supported during daily activities, like walking, bending, or lifting. Speaking of lifting, reducing heavy strain is one of the most effective ways to protect your pelvic floor. I always remind my patients that their pelvic tissues are like a hammock. Every time you lift something heavy or strain during a bowel movement, the hammock stretches. Over decades, this can weaken it. That is why managing constipation is absolutely essential. Staying hydrated, eating fiber-rich foods, and using gentle stool softeners if needed can prevent unnecessary pressure. Women who reduce straining often see immediate improvements in their symptoms. Now, let's talk about pessaries, one of the most helpful non-surgical options available in the United States. A pessary is a small, flexible device placed inside the vagina to support the bladder, uterus, or vaginal walls. Many women describe it as wearing a comfortable support brace inside the pelvis. It does not hurt. It does not feel like a foreign object once fitted correctly, and it can significantly reduce pressure, bulging urinary symptoms, and discomfort during daily activities. Some women use a pessary long-term. Others use it temporarily while deciding whether surgery is right for them. The best part is that pessaries come in many shapes and sizes, from simple rings to more supportive designs. If you prefer to be independent, a clinician can teach you how to remove and clean it at home. If that feels overwhelming, your clinician can do it for you every few months. Many older women appreciate that this option is low-risk, reversible, and does not require anesthesia. It is especially helpful for women who are not sexually active or who want to avoid surgery. But what if non-surgical approaches are not enough? That is when we begin discussing surgical options. Today's prolapse surgeries are far more refined, less invasive, and more successful than those performed decades ago. The techniques focus on restoring natural support, strengthening weakened tissues, and anchoring the pelvic organs in a stable anatomical position. And in many cases, these surgeries can be done through tiny incisions or even vaginally without large cuts or long hospital stays. For women who have had hysterectomies, sacral colpexy is a highly effective procedure that uses a mesh graft to suspend the top of the vagina to a strong ligament near the tailbone. For women with their uterus still intact, uterosacral or sacrospinous ligament suspension supports the uterus or upper vagina by attaching it to the natural ligaments that once held everything in place. These approaches are strong, stable, and designed to last. When the bladder or rectum is involved, surgeons can perform targeted repairs that bring separated tissues back together, restoring strength and reducing bulging. These procedures work much like repairing a hernia. They tighten what has stretched and give the organs the support they need to function properly again. But the key point is this: not every woman needs surgery, and not every woman needs the same type of surgery. Your treatment should match your symptoms, your health, your lifestyle, and your personal comfort level. You deserve choices, and you deserve a plan that supports you without fear or embarrassment. In the next part, I want to share real stories of women who struggled for years before finally finding the right solution. Their experiences may help you recognize what is possible for your own journey. I want to take a moment now to share a few stories from women I have cared for over the years, because their experiences have helped so many others understand what prolapse truly feels like and what recovery can look like. When you hear yourself in someone else's story, everything becomes clearer and the fear often softens. Sometimes all we need is to know that someone just like us found relief. One woman in her early 70s came to me after struggling for more than a decade with a sensation she described as a small ball pushing downward every time she stood up. She told me she planned her entire day around how long she could remain upright before she needed to lie down to put things back where they belonged. She had stopped going to her gardening club. She declined invitations from friends, and her daily walks had disappeared entirely. When I asked why she waited so long to see someone, her answer was simple. She believed it was shameful, and she feared she would be scolded or told there was nothing to be done at her age. When we completed her exam, she cried a little, not from pain, but from relief. She said no one had ever explained what was happening inside her body. She felt her world shrink over the years because she blamed herself. But once she understood the anatomy, the causes, and the treatment options, she felt something she had not felt in a long time. Hope she chose a pessary first, and within days, the heaviness nearly disappeared. Months later, with more confidence, she decided on surgery. Weeks after she healed, she sent a picture of herself on a walking trail with her granddaughters. She said it felt like getting her life back. Another woman in her mid-60s experienced a different challenge. She never saw a visible bulge, but intimacy became uncomfortable, and she felt constant pressure in her lower abdomen. She assumed it was related to menopause or dryness. Only when her urine began spraying sideways did she realize something more was happening. She described feeling embarrassed every time she used a public restroom because she could not predict where the urine stream would go. When she came in, she was convinced this was something strange or rare. Her prolapse was moderate, mainly involving the bladder. We discussed pelvic floor therapy and vaginal estrogen, and she committed to both. A few months later, she said her confidence had returned. Intimacy no longer caused discomfort, and bathroom trips felt predictable again. She did not need surgery. She only needed the right guidance. Let me share one more experience because it illustrates something very important. A woman in her 80s came to me with her daughter because she was experiencing advanced prolapse. The tissues had weakened significantly, causing the organs to slip outside the vaginal opening when she stood for long periods. She was not seeking intimacy at this stage of life, but she wanted comfort. She wanted to walk, sit, and attend church without discomfort or embarrassment. We discussed several options, including a procedure called colpoceus, which closes the vaginal canal to provide strong support. It is designed for women who are no longer sexually active and want a simple, effective fix. The surgery was quick, and she recovered beautifully. At her follow-up visit, she told me something meaningful. She said she felt like she finally had control of her body again, something she thought she had lost forever. These stories are not rare. They are reflections of what millions of women experience but rarely talk about. And each one teaches us something valuable. Prolapse is not the end of activity, comfort, or confidence. It is a change in anatomy, and changes can be addressed. The right treatment depends on your needs, your health, and your goals. I often explain prolapse using a simple analogy. Think of your pelvic floor like a hammock that supports precious cargo. Over time, the fibers loosen. A hammock does not collapse suddenly, it sags slowly. And a sagging hammock can be tightened, supported, or reinforced. Your body works the same way. Support can be restored. Comfort can return, and your life can expand again instead of shrinking inward. As we move into the final part of this video, I want to bring everything together for you. Understanding the problem is empowering. Seeing real solutions is reassuring, but the next step is taking action. You deserve a plan, and I want to help you shape it. As we come to the end of this conversation, I want to bring everything together in a way that feels clear, practical, and reassuring. Pelvic organ prolapse is something many women struggle with silently, but silence does not protect you. Knowledge does. Understanding what is happening inside your body is the first step toward feeling comfortable and confident again. Let's take a moment to revisit the key points. Prolapse is not a rare condition, and it is not a sign that your body is failing you. It is simply a result of the natural wear and tear that happens over time, especially after childbirth, menopause, chronic constipation, or years of lifting and daily strain. Your pelvic floor is made of muscles and connective tissue that work hard for decades. When those structures weaken, the organs shift. That shift is what creates the pressure, the bulge, the changes in urine flow, or the difficulty with bowel movements. The important thing to remember is that prolapse does not improve by ignoring it. But it also does not mean that surgery is inevitable. Many women notice real improvements with vaginal estrogen pelvic floor therapy, better bowel habits, and simple lifestyle adjustments. Others benefit greatly from a pessary, which can support the organs and reduce pressure without invasive procedures. And for women who need surgical repair, today's techniques are safer, more precise, and far less disruptive than in previous decades. I want you to know that it is never too late to seek help. Whether your symptoms are mild or advanced, whether you are 55 or 85, you deserve comfort and the freedom to move, walk, sit, and live without feeling something slipping inside your pelvis. You deserve to feel at ease in your body again. If you relate to anything we discussed today, the next step is simple. Speak with a clinician who understands pelvic health. A gynecologist or urogynecologist can evaluate how much support has been lost and guide you toward the best solution. You do not have to diagnose yourself, and you do not have to manage this alone. Asking for help is an act of strength, not embarrassment. I also want to encourage you to trust your instincts. If something feels off, if pressure is interfering with your daily routine, or if the bulge you feel is growing or becoming uncomfortable, let someone examine you. The sooner we understand what is happening, the more options we have to support you comfortably. Many of my patients tell me they wish they had come years earlier simply because of how much better they felt once we created a plan together. Before we close, I want to leave you with a hopeful message. Your life does not have to shrink because of pelvic discomfort. You can return to walking, traveling, laughing, gardening, attending church, playing with grandchildren, and being active in the world again. Prolapse may change your anatomy, but it does not define your future. You have options, and you have control. If this video helped you understand your body more clearly, I would love for you to join our community. You can subscribe so you do not miss the upcoming videos where we talk about bladder health, bowel habits, pelvic floor strength, hormone changes after menopause, and many more topics that matter deeply to women over 60. And if you feel comfortable, share this video with another woman who might be silently struggling. Sometimes one shared message can change a life. Thank you for spending this time with me. I hope you feel seen, understood, and supported. And I hope you take the next step toward comfort and confidence. You are not alone, and you do not have to live with pelvic pressure or embarrassment any longer. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized